When you think about how accepted plastic surgery is, and especially this younger generation now, I'm glad that I waited till I was in my mid 30s
Yeah.
to go see you
Yeah.
and get my breasts done.
Yeah.
At what age do you think it's acceptable for a young lady or a young man to come to you and say they want something done?
Well, I'll tell you, in the Persian culture, like sometimes it's a graduation gift, or like when you're about to graduate, you know? The families that have money, you get a white Benz or a BMW and a nose job. Like that's not uncommon, especially in the 90s, 2000s. So there's a lot, and I did one today. I do them all week long. Our teenagers, the most common thing for teenagers is ear pinning, which we can do at 9 or 10 years old because it's finished. People getting teased at school for that. Of course, we do cleft lip palate reconstruction. Someone that had a cleft lip, their nose is usually caved in, and I rebuild the nose, and that can happen at 12, 13, 14 years old. But in general, you're fully developed enough to do facial surgery around 16, 15 and a half, 16, 17. So nose jobs are very common as teenagers. Breast augmentation, things like that, I feel like someone should be a little more developed, not only mentally, but you know, our cortex that makes decision making happen, our frontal cortex is not mature till we're 20, 22. So you can't really make full decisions honestly till then about a lot of things. So for me, for my practice, nose jobs happen in teen years because that's pretty straightforward. I mean, if the nose enters the room before you do and you're getting teased about it,
Yeah,
I'm going to work with you. The parents come in, we're all involved. But as far as body surgery and all that, it can go into, I've done tummy tucks. I've done S-curves on 75-year-old divorcees. So
You're never too late.
Yeah, exactly. So, and my favorite though is, you know, if somebody comes in and they're trying to do this for like the wrong reasons, I mean, I'll be honest, a lot of people do come in and it's not a bad idea to get the ex a little jealous or something, the revenge body, that happens. But if you're doing it only for that and it's not something you really want to do, or you're doing it for someone else, or if you're doing it because your man wants you to, those to me are the wrong reasons. If I connect with someone and I know they're doing this for themselves, then it becomes just a continuum of everything else they do to improve themselves. Their skin, taking care of their hair, taking collagen, doing sauna, cold plunge. And sure, if you're not going to grow your breasts, you do breast augmentation. If you have stubborn love handles, you've gone to a trainer for 2 years, people hate on the gram and they say, why doesn't she just do squats? That doesn't happen. You know, you can't just do squats and have your waist go from this square to a curve.
How much has mental health and, you know, plastic surgery played hand in hand? And is there ever a time where you tell people, I don't think this is what you need. I think maybe you need to see a different type of help. It's not.
You know, to be honest, the ones that tend to be like that are the ones that have been through it already, where the surgery they've gotten almost is like they came out of Vietnam, or like there's some PTSD associated with it. And I can sense that. And you know, one of my guru mentors once said, if you can't make a patient smile at least once, like a genuine smile, and I try to be funny, you've known me for a while. If I can't make a patient smile once during a consult, I'm not going to operate with them. The other rule I use is if this isn't someone I wouldn't mind talking to at a wedding or an event for a few minutes and sitting down, having a drink and chatting with them, I may not want to operate on them. So I kind of go by those criteria. But yeah, the ones that have had 3, 4 surgeries now, I'm an expert in revisions, and when you've been in the game as long as me, you're going to see people who've been, I hate the word botched because sometimes it's just something's a little off.
Yeah.
Botched makes it seem like it was just destroyed
Right.
and you need to salvage it. But someone who just needs more tweaking or a little more improvement, those ones are okay. But if someone's on their 3rd, 4th, and they really don't have a reason to be, and they come in like stone-faced, not smiling, then I know they need to seek some other type of assistance and therapy. You know?
Why do you think that plastic surgery has had such a bad reputation in the past and now it's more acceptable?
Well, because like I said, good plastic surgery you don't detect. We can all name like immediately 3, 4 people that are like, whoa, you know, and I don't want to mention any names, but that gives it a bad rap. But to be honest, you know, nothing against your industry, but media does focus on the sensational and the like amazement. The ones I do, they're so gorgeous, subtle in my opinion, and like just do it right, and it just like goes with their persona. Their own family at reunions can't detect it. That's not going to make headlines. But somebody who basically has no nose anymore, or whose butt is like this, that's going to make headlines.